This Guy's Garage. Like and subscribe.
Thanks for getting to this very, very important study. Obviously, we know the statistics. Canadians know the number of people dying. 1,900 people have died, of course, thus far in 2023. Ms. Sachs, maybe you could tell listeners out there, what is the leading cause of death in BC in 10 to 18-year-olds?
10 to 59-year-olds in BC overdose deaths from opioids is the leading cause of death.
What about 10 to 18-year-olds specifically?
I believe that the leading cause of death for the 10 to 18-year age group is also overdose deaths.
Yeah, it's a very sad state of affairs. You know, I guess I have a bit of a rhetorical question, but we'll get to that. You know, what's it going to take to stop this experiment, the safer supply, whatever euphemism we're going to use? You know, there's a recent article came out, I think, on Friday, of a person with lived experience talked about being at the Leslieville, the South Riverdale site, speaking about safe supply. Are you aware of that article?
I'm not aware of the specific article. I would need more details, but I know that there have been a number of articles about safer supply as well as supervised consumption sites in recent days.
This article specifically talks about safer supply, talks about a few other things, but is the Government of Canada aware that the so-called safer supply is ending up in the hands of folks who previously have not used opioids?
What the government is doing right now is undertaking and investing in a suite of services, which includes prevention, education, harm reduction, treatment.
I'm sorry, maybe you misheard me. I'll interrupt you. I apologize for that. But are you aware that the so-called safer supply is ending up in the hands of folks who've never used opioids before? I didn't ask what the government was doing. I asked a very, very specific question. Thank you.
So I think the government is aware that there are a range of views regarding prescribed pharmaceutical alternatives that are being used in harm reduction and treatment purposes for individuals who use substances. We are listening to those. I think we are listening to concerns as well, taking those very seriously. There are a number of actions that we are taking.
Okay, thank you for that. I'll interrupt you there. We have a convention here that you'll answer in length of my question, so thank you. Is the government aware that the price on the street of a 8 milligram tablet of hydromorphone has gone from approximately $20 a pill to $2 a pill?
Again, I would repeat that we understand that there are a range of views and perspectives and reports in terms of prescribed pharmaceutical alternatives. We are taking concerns that are being raised seriously. We are looking into those. We are taking a number of actions.
Thank you. Thank you very much. I'm trying to be very kind here, but I'm asking very specific questions to which you're really not answering. Is the government aware, your department aware, that the on-the-street price for 8 milligram tablets of hydromorphone has gone from $20 to about $2 a tablet?
We are aware that there are reported concerns with diversion of prescribed pharmaceutical alternatives, including as a result of the price of that.
Is the government aware that these tablets of hydromorphone 8 milligrams, which is equivalent of about 30 tablets of Tylenol 3, is actually being used in high schools around this country?
I think the government is aware that the use of illegal drugs is absolutely of concern for youth across the country, and that is why we're investing in prevention and education in a suite of services and supports.
Once again, I'm going to interrupt you. I'm trying to be kind, but it seems to be being purposefully avoiding answers to my questions. Is the government aware that the so-called safe supply is actually being used in high schools in Canada?
We are aware that there are people who are concerned that there is diversion of prescribed safer supply.
So I guess if you're aware that there people are being concerned if you are aware that people are concerned this is happening, then wouldn't that mean that you're aware that it's happening?
We are taking reports of diversion seriously. There are a number of actions that we are taking. We are committed to taking those actions. That includes working with Safer Supply products to understand the risk mitigation measures they are taking, including patient screening, including urine drug checking, screening, including working with healthcare providers and patients to ensure that risk mitigation measures are in place to reduce any diversion. We are looking at evaluations and studies, and I'm happy to turn it over to my colleague at CIHR for further information in terms of some of the evaluation that we are doing on
Thank you.
prescribed
Thank you for that.
pharmaceutical
When the opioid experiment began, and I'm using the words of my colleague, Dr. Hanley, which was in the text of this motion, what was the original null hypothesis that the government put forward for the experiment?
Could you repeat the question at the beginning?
Yes. What was the original null hypothesis generated for this experiment? We all know it was an experiment. It's never been done before. So in an experiment, you really have an idea of what you want to disprove. So what was it? Or was this just something on the back of a napkin, I guess is the question.
I apologize. I think you'll have to just clarify for me what you're referring to by this experiment.
Yep. Well, it's in the text of the motion that we're debating here today that this is a drug experiment. So what was the plan?
I think the government...
Was there a plan?
There is a plan. There's a very clear plan that the minister announced on October 30th, which really directs where the government is going, which is the renewed Canadian Drugs and Substances Strategy.
I'm just going to interrupt you because you said October 30th. Question, Ms. Sachs. When Purdue Pharma supercharged the distribution of OxyContin starting in the United States, it's generally accepted that was a bad thing for society. Is that correct?
I think there are, there were concerns then in terms of how, at the beginning of the opioid crisis and prescription of opioids and the implications that had.
Sorry, Ms. Sachs, I'm just going to interrupt you there, but isn't it true that the Sackler family of Purdue Pharma was sued by the U.S. government for billions of dollars for that action?
Correct.
Thank you. So that would mean it'd be a bad thing, probably.
Well, there were many
Simple
concerns,
yes or no.
including the Canadian government has expressed concern. Absolutely. There were
Okay,
concerns.
thanks. So tell me this then. Why is it a good thing that the Canadian government is now giving people 30 tablets of 8 milligrams of hydromorphone for free?
The Canadian government is investing in certain programs, which includes prescribed pharmaceutical alternatives as one of a suite of measures. And
I'm aware of what they're doing. I'm just trying to get you to answer the parallel. It's quite obvious. When Purdue Pharma did it for money, it created a public health emergency. When the Canadian government gives these drugs away for free, we think it's okay.
The Canadian government is looking at providing a range of services. As I said, often these programs are part of a suite of services so that individuals can connect with primary health care, mental health services, housing, job training. It is creating a connection to health and social services and support.
Ms. Sachs, all of that stuff makes perfect sense. Giving it away for free doesn't. The other question I would ask you is, on Canada.ca, it says a few grains of fentanyl can be enough to kill you. Is that true?
That could be true, yes, depending on
It
someone's...
could be true. It's on the Health Canada website.
Yes,
it must be true. Is it there or not?
Fentanyl could, in certain
A few grains could kill you. I'm going to badger you a bit on this because it says right on your website.
Yes.
Thank you. Wow. That took a lot. Tell me this then. What sense is there to decriminalize 2.5 grams of fentanyl? If a few grains could kill you, what sense is there in that?
I can add. First of all, I think in the exemption for BC, it is clear that trafficking of drugs, so if that is pure fentanyl, right, any trafficking of drugs remains illegal, even under the 2.5 grams. And so when we are talking about the exemption BC, we are talking about the personal possession, personal use of a total of 2.5 grams, which will include, other substances that can be cut with whatever, the substance that they are using.
Thank you. I mean, I understand all that, but let's talk a bit about amounts. Let's say, from some American data, I used other data previously, but a lethal dose is as little as 0.25 milligrams. That means 2.5 grams is enough to kill 10,000 people. 10,000. Now, we had the minister here before, it's cut with something. Let's cut it in half. 5,000 people, let's cut it in half again. 2,500, let's cut it again. 1,250 people that one person is allowed to carry. Is that appropriate? Simple question. Is it appropriate or not?
The threshold that was used in BC was developed based on a range of factors, including patterns of use, the data that we do have, including from law enforcement. There were a range of factors that were considered to establish a threshold. It is a cumulative 2.5 grams. And as I mentioned, trafficking, even below the 2.5 grams, remains.
Thanks. I'm not talking about trafficking. I have one final question. We talked about the addiction medicines experts who requested to meet with Minister Sachs, talking about this is not harm reduction, it is harm. It's not safe supply, it's reckless supply. It is reckless. It's reckless for people suffering from addiction. It's disregard for our communities. There's a complete failure of monitoring, supervision, abrogation of responsibility. Will the minister agree to meet with these physicians who wrote this letter?
I can't speak on behalf of the minister. What I can
Will
say
your
is that
department meet with them then?
we are happy to meet with a range of
that's your
experts
time,
with
Dr.
different
Ellis.
perspectives.
Go ahead and answer the question. Take 20 seconds if you need
I
it.
can say from a departmental perspective, as I mentioned earlier, we are happy to meet with a range of experts and differing perspectives to better understand concerns, risks, and benefits with current actions that are being undertaken.